Good afternoon. My name is Jacob Palomar, and I will be doing my PowerPoint presentation on syphilis. What is syphilis? Well, syphilis is a sexually transmitted disease, an STD. The difference between an STD, a sexually transmitted disease, and an STI, a sexually transmitted infection, is that an STD will show symptoms while an STI does not. Syphilis is caused by the bacteria Treponema pallidum. This bacteria causes an infection when it gets to broken skin or mucous membranes, usually at the genitals. This is a microscopic view of the bacteria Treponema pallidum. How can you get syphilis? Well, a syphilis sore is called a chancre. Syphilis is transmitted from one person to another by direct contact with a syphilitic sore. Syphilis is transmitted through sex, such as anal, oral, and vaginal sex. The way a baby can contract syphilis is when a pregnant woman with syphilis is giving birth, and on the way out, the baby will touch a chancre. Symptoms of syphilis. Syphilis has been called the great pretender, as its symptoms can look like many other diseases. However, syphilis typically follows the progression of stages that can last for weeks, months, or even years. Syphilis develops in 4 stages, and symptoms vary with each stage. Chancres are harder to notice because they are usually painless and may be hidden within the vaginal or rectum. Chancres will first develop where the bacteria has entered your body. While some only have one chancre, others may have many. The chancre will heal on its own within 3 to 6 weeks. Some people would think that it went away, but that is usually not the case. If left untreated, the infection will not go away, but goes on to the second stage of syphilis, known as secondary syphilis. The chancre that went away weeks ago will now come back and cover your body as a rash. The rash will cover your entire body from your head to your toes, even the palms of your hands and the soles of your feet. It will not be itchy. However, it may be accompanied with wart-like sores in your mouth and genital areas. During secondary syphilis, some may experience hair loss, muscle aches, a fever, sore throat, and swollen lymph nodes. This would once again disappear without treatment, but if left untreated, syphilis will move on to the latent and possibly the tertiary stage of the disease. The latent stage, also known as the hidden stage. It is called the hidden stage because it is a period of time where there is no visible signs or symptoms. The signs and symptoms may never return, or the disease may progress to the tertiary stage, the last stage. About 15 to 30% of people infected with syphilis who do not get treatment will develop complications known as tertiary stage. Tertiary syphilis is rare and develops in a subset of untreated syphilis infections. It can appear from 10 to 30 years after infection was acquired. It can be fatal. Tertiary syphilis can affect multiple organ systems, such as your brain, your nerves, eyes, heart, blood vessel, livers, and your bones and joints. This can even lead to death if left untreated. How to prevent syphilis? To prevent syphilis, you can practice safe sex by a male using a male condom and a female using a female condom. Safe sex can not only protect you from contracting syphilis, but also from contracting any other STD and STI. Another way to prevent syphilis is before having sex with your partner, ask if they have syphilis or any STD or STI. Cure and treatment for syphilis. The cure for syphilis is an injection of penicillin into the buttocks. If you cannot take penicillin, then your doctor will prescribe you antibiotic tablets, but they will take longer to treat the disease. Follow-up blood tests will be recommended once treatment finishes to check that it has worked. When cured at whatever stage, it will not take back any damage that was done to your body. Overview. Syphilis is an STD that is very common. It can be cured at any stage, but any damage that has been done to your body will be left there permanently. Thank you.